Brooke Sposito was just a freshman in high school when she felt a subtle but serious problem during track practice.
I noticed after doing a lap, I was breathing kind of heavy, so I was thinking, maybe I should change my eating habits, maybe do more exercises during the weekends for track meets.
But the problem wasn't with her diet or exercise routine. With no history and no warning, Brooke was actually having an asthma attack brought on by exercise. It's a problem that quietly affects hundreds of thousands of athletes every year, and a new study shows that when it happens, few teams are prepared to deal with it.
A significant number of athletes, if they have an episode of asthma on the sideline, are not going to have the treatment needed immediately.
That's something Dr. Jonathan Parsons of Ohio State University Medical Center would like to change. He says simply having one of these rescue inhalers on the sideline could not only help athletes breathe easier, in some cases could save lives. But in his research, he found that at the college level, 40% of teams have no policy in place to make sure inhalers are on hand.
It may be more importantly, we found that only 17% of the programs responded said that they used some form of objective testing to document whether an athlete actually has asthma or not.
That testing is important because the symptoms of exercise-induced asthma are very subtle. Many athletes assume that the shortness of breath, wheezing, and fatigue are just part of the routine. But in cases like Brooke's, they prove to be serious symptoms of a disease she never knew she had. At Ohio State University Medical Center, this is Clark Powell reporting.